As the Delta variant continues to surge in other parts of the country, concern for those who are not vaccinated is on the rise. And that includes kids under the age of 12 who are currently not eligible for the COVID vaccines. Avera's chief medical officer says kids are less likely to become seriously ill if they're infected, but those under 12 are still being hospitalized.
The folks 12 and over, the vaccine is the tool that we have to stop this virus. It only works, though, fully with herd immunity. We've got to get there. Once it is approved for kids 12 and under, please think about getting your kids vaccinated.
Dr. Elliott says not only does the vaccine protect against the virus and long-haul COVID, it will also slow the development of dangerous variants. Pediatric testing for the COVID vaccines is currently underway. Well, in Sioux Falls, most of the older population has been vaccinated. It is the younger, healthier people who are still avoiding the shots. KELOLAND's Tom Hansen shows us what the city is doing to try to boost the number of vaccinations to stop the spread of the Delta variant.
Michelle Wellman has an underlying health condition and jumped at the chance to get protection from COVID-19.
I am vaccinated. I've been vaccinated since April. And I almost cried when I got it because I was so thrilled to be able to be protected.
But younger people with no chronic health problems are not getting vaccinated in large numbers. Sioux Falls Public Health Director Dr. Charles Chima says he's setting up focus groups to find out why.
Why we're doing this is to really listen and to understand, right? Because we don't want to make assumptions.
There's an urgency to getting the shots because school is about to start and kids under the age of 12 can't be vaccinated.
Think about the children when we make these decisions. If the only thing I can do to protect children in our community right now is to go and get a shot, that should be something else that we should consider when we make that decision.
Chima says some people are still on the fence, waiting to make sure the vaccine is really safe, even though millions of people have already gotten it.
I do not know people who have gotten the vaccine and regretted it. But you know one thing I know for sure. In the last 1 week alone, there are so many instances of individuals who, right before they were intubated, right, in the intensive care unit, their last regret is I should have just gotten this vaccine.
All you have to do is look at the news. I mean, a woman lost her legs. People are losing their life. They're losing family members.
And that's exactly why the city is trying to boost vaccination rates now before it's too late. In Sioux Falls, Tom Hansen, KELOLAND News.
And the focus groups will run for several weeks. The city will use that information to target their message to the groups who are avoiding the vaccine.